Hi everyone, thanks so much for joining today. We're just going to wait a little bit longer to let some more folks roll in. This is the Bike to Work Society, and we are putting on our webinar workshop. This is Meghan Winters from Fraser University and the Cities Health and Active Transportation Lab. Before we get started, Meghan, you say that you are an avid cyclist for recreation and commuting. Can you tell us a bit about a bike ride that you've done recently?
Yeah, I can tell you about yesterday's bike ride. So, during COVID, I'm working from home as many other people are, and the kids are around. So we had school's out, but we had a recess break in the afternoon and headed out under the direction of my 10-year-old, who said that he could confidently take us. I live in Vancouver. He could confidently take us around the Cambie Loop. So that would be like from my house around the Cambie Bridge Loop. And I would just say it was a bit of an adventure. So if you're from Vancouver, there's sort of an easy way to go about it and a way that you can't easily get onto the Cambie Bridge. So there's one way of doing a Cambie Loop that would mean the infrastructure spits you onto the bridge and works fairly well by bicycle. And that's the only way I've ever ridden it, actually. But because he was leading, he took us on this other route, which involved more downtown separated bike lanes, which he was happily taking us on. So I guess what I'm highlighting is when you let somebody else lead, sometimes you learn all sorts of new routes in a city, and you might also learn what your children are capable of.
Yeah, that's awesome. A 10-year-old just like gunning through the streets.
I suggested maybe next time he goes out with his friends, he takes the easy way to get on the bridge just for safety's sake. But it turns out he is capable of managing sort of left turns from protected bike lane to protected bike lane on a downtown street. So
amazing.
Good to know.
We love to see it. Okay, it is 11:03, and it's great to see so many people here today. Maybe we'll wait one more minute and see if there's any more folks that are going to join us.
I can give you another recent bike ride if that'd
be great. Yeah.
Them into some chitter chatter on the discussion later, but there's another researcher at SFU who's really into electric unicycles, and as part of her research, she wants to do ride-along interviews to see how different people respond to electric unicycles and other micromobility in shared spaces. So we gave it a trial run. So I met up with them and we went off. They were on their electric unicycle and I was following along behind them, and we rode from Science World in Vancouver out to Jericho Beach. And it was just a really interesting thing to follow along right behind. So they're a very careful rider. They had a lot of protective equipment on, and it was really bright orange too. So I felt like for a while I was trying to figure out, would people stare at us this much if it was a little less obvious or less visually present. But it was just kind of a neat thing to explore in the city and to see the different pacing. One thing I did learn was those electric unicycles actually don't stop. You can sort of like, as with the unicycle, you can like go back and forth to sort of hold your position. But if you stop it, you step off it. And I didn't even realize that until I was riding. You ride it on a bike, you want to stop, you just press your brakes and you come to a stop. And they can stay in a small area wiggling back and forth, but just the idea that you don't come to a stop. It's like, oh, that's different.
Yeah, that would make me nervous.
They said it would take me, they've taught many people to ride electric unicycles, and they said it takes a couple of weeks, or if you're a kid, it takes about a half an hour. So
well, there you go. Okay, so we got lots of people here today. So great to see such a good turnout. I'm just going to introduce what we're doing here today. So we started our webinars this spring to continue serving our community throughout the challenges of the pandemic. So thank you all for attending another great webinar, and welcome to those joining us for the first time. My name is Justine, and I'm the Bike Skills Program Coordinator here at the Bike to Work Society. Today I'll be acting as a moderator for the webinar, which is Impacts on Bicycling Infrastructure in Mid-sized Cities, presented by Dr. Meghan Winters. I'm very excited to be introducing Meghan this morning. She is an associate professor in the Faculty of Health Sciences at Fraser University, as well as a lead researcher for Cities Health and Active Transportation Research Lab, which actually developed the study which we're going to hear the results for this morning. Meghan is a lifelong bike commuter and recreational cyclist and believes that cycling is simply the best way to get around. Naturally, we at the Bike to Work Society feel the same. The presentation itself should be about half an hour to 35 minutes. That leaves plenty of time for Q&A at the end with Meghan. During the webinar, we encourage you to type out any questions you may have for this Q&A, and that will be located in the question box, which is found in your control panel, which should appear at the right side of your screen. We're going to save all the questions until the Q&A period, but anything we may not get to, feel free to email myself or Meghan after. I'll provide our emails at the end. If there are folks experiencing audio or visual problems during the webinar, I would suggest closing down the entire program and re-entering using the same link you would have used to attend just now. Anything you may have missed will be available on our website, on our YouTube channel as well, with the recording of this webinar, hopefully by early next week. For those just joining us, welcome. Once again, this is the Bike to Work Society's Impact of Bicycling Infrastructure in Mid-sized Cities study presentation with Dr. Meghan Winters from Cities Health and Active Transportation Research Lab.
Thanks so much. So thanks for the invitation. I'm always happy to talk to different audiences in different places and to share this kind of work. I'm going to talk about some study, sort of the work I do, some of these study results, and I'll end on sort of like some observations in recent months since COVID. So we'll keep some time for that at the end and see where the discussion goes. So I lead a research group at SFU, Cities Health and the CHATR Lab, as we call it. I want to just highlight that I'm a population health researcher, but I work across health, cities, and transportation. And what I really try and do is study real world changes that are happening and answer questions that matter and get that evidence and research to policymakers in order that they can enact change. So we work on things about active transportation, how people get around, and also on social connectedness, how they connect with each other, and how community design impacts that. So it's been a busy time in my research program for sure. I just wanted to, in case there's other topics that might be of interest to the group today, this is sort of a screenshot from various projects. I know it's small, but the link to the website is on the bottom there, and we've got descriptions of a number of our projects, including the one I'm talking about today, which would fall into that mid-sized cities one. But there may be people on the call who are interested in other topics, and you can find more information there as well as my contact information. So today I'm talking about a study that's been going on since 2016. In mid-sized cities, we found that a lot of the work that happens on cycling is often in the Torontos, the Vancouvers, the Montreals, and the mid-sized cities are sometimes overlooked. So a number of years ago now, we started a study just as Victoria was trying to build out the AAA bicycle network and get started on that, because it was meant to be a really massive intervention happening, like a bold move happening. And so it was a great opportunity for us to design a research study that was wrapped around that, as well as helping the city answer some of the questions. So for instance, we were interested in how the investment in the bicycling network impacts of the all ages and abilities riding a bike, what the impacts were in terms of equity and access in which neighborhoods benefit, impacts on safety and collisions, as well as health-related economic benefits. And we've been moving that along. The timeline here is just meant to show you how we've been moving along this big 5-year study. So we don't have sort of the end results yet. I have presented to various groups in Victoria following up on our first year in 2016, and then this is sort of our midpoint 2019 kind of data, and I'll focus on sort of the from these slides. What I find, and we have a website for this, which there'll be a link at the end as well, or from my CHATR Lab, where we post all of our presentations and results, because I want to make sure this kind of work is readily available and accessed by people who need it, which could be municipal staff, but are certainly also advocacy groups or residents who are interested. We're trying to, in general, reflect, I'm a population health researcher, so I'm trying to study what sort of the general population thinks, and sometimes the narratives within this may be complementary or may counter sort of those loud voices that you hear in the media. So when you need to know, like, on average, what do people think? These are the kinds of data points that are hard hard to gather and take resources to gather, and that's part of what I hope this study is doing. So as mentioned today, I'm going to focus on our 2019 survey results. The study happens in Victoria and two peer cities that we decided upon early on, and so that's Kelowna and Halifax. You'll see them pop up through here sort of for comparison purposes, but I've focused what's in here on Victoria results. I am going to show you quite a slew of data in the next 10 slides. If it's hard to digest, you'll have access to these slides later, but I just wanted to give it, and we have much, much more data actually. So I just want to give you and this group a sampling of what's available, and happy to follow up on particular questions and interest areas. Just so you know where the data came from, our study area is Victoria and the surrounding communities, so Esquimalt, Oak Bay, and Saanich as well. So this is the study area, and the data comes from 864 people who either lived or worked within that study area, and it was a telephone survey that happened in the fall of 2019. Okay, so this is all pre-COVID answers, to be clear, and you can put that in a timeline of where we're at. So in terms of results, I'll show you sort of like a high-level result, and then I'll break it down by demographic groups, because often people or certain audiences and presentations are interested in who's saying what. So just there'll kind of be sets of 2 slides on each thing. Just as a starting point, one of the questions we asked is a sort of general, very general question about overall which mode of transportation do you use most often to get around. It's a survey question that's used in regional surveys here as well. And so not surprisingly, of course, most people are using motor vehicles, but you see the differences across the 3 cities that we're studying, and that's important context for us as we go about doing our research, especially things like Halifax and its dependencies. So this would be different than the mode share data that we cite from the census, because that's asking just about work trips, or about regional travel surveys, which ask a proportion of all trips, so you might be familiar with those data sets. This is the self-report, what do you use most often? And to show you that, I'm going to show you overall slides, and then I'll hone in on Victoria, and I'll show you that according to different demographic groups. So you can just read on the side the high-level comment that bicycling, walking, and transit as primary modes are highest among young women, young people, among women, young people, and households with, as you know, but if you're interested in sort of the breakdown of responses to that, I wanted to provide that. So this audience is probably most interested in bicycling, and so that many people use it who it's not their primary mode. So amongst the people that we surveyed, more than half of them said that they've used a bicycle in the past year. So this is a generous definition of cycling, you would say, but also a like, oh, well, who could be using it? Like, who could tap into this? So I think you're safe saying that half of Victoria respondents have used a bicycle in the past year, more than. And the other thing that we added in 2019, which we hadn't before, was just to identify who had a health, physical, or sensory issue that limited their ability to walk or bike. So to sort of carve off that group that might have difficulty adopting this. So likewise, when we break that down according to demographic information, you can see that cycling was most prevalent in middle-aged people in Victoria, people with higher incomes and household with children. So that's that ever cycling, and then you see the difference between who cycles as a primary mode versus who uses bicycles at least once in a year. Different demographic composition of the infrequent cyclists. So we also added in a sort of frequency question, and this is a place where, while I won't show it here, you see a much different patterning seasonally in Victoria than you do in Halifax and in Kelowna, where the winters would be more prohibitive for cycling. But it was really notable that in Victoria, there were very many year-round cyclists and people maintaining that sort of frequency of cycling across the seasons. So a lot of our work is concerned about sort of who that audience might be for cycling. This fits with the typology that you've probably, many of you have heard about, that kind of Geller typology of the interested but concerned group. And at the time, the city was quite interested in knowing, in our city, what is the interested but concerned? So in Victoria and likewise in Kelowna, about a third of residents are interested in cycling but are concerned. And then you can also see that sort of no way, no how, enthused and confident, strong and fearless. So these are sort of tags put onto them. There's different ways of getting to, for what it's worth in research, this is a complicated kind of thing, but in this, what I'm presenting here is just, we simply ask them the question, and you can see the questions are written at the bottom here. In terms of your attitudes towards cycling, what would you describe yourself as? So breaking that one down by demographic, the people who were interested but concerned tended to be women. People who were less confident, we really noticed that differentiation, that a lot of those were women, and the people who were currently non-cyclists said that they were. I would underscore that people who have cycled in the past year still say that they may be interested but concerned cyclists, so it doesn't differentiate exactly on whether you cycle or not. We asked about safety in their community, so just like a really high level reported question. This wasn't to look at which places are safe or not, the kind of way that maybe bikemaps.org would do, or a different kind of data collection, but this was, in general, and comparing that across the different cities that we're in. So nearly half of Victoria respondents thought their city was safe for cycling. This doesn't identify regions or areas, which we all would agree and that in terms of cycling and who's concerned about cycling, bicycling safety concerns were higher among older people, women, lower income households, and those who hadn't. So that's what you would expect, but sometimes is sort of the fodder that people, where their concerns are coming from. So we did ask about those, what barriers people had to cycling. We have analyzed this in terms of who reported which kind of barriers, but across the board, it has to do with fear of traffic and connected bicycle routes, the main factors in influencing whether people decided to ride or not. A lot of the things that we often hear about might be things about steep hills, which you see is still down at the bottom. So I guess you can read that in many different ways. One of them might be that people are just familiar with the places where they ride and the hills are there or not. But I want to highlight that things that we can, affect and change to some degree were really those top barriers that people on average reported as being the biggest factors influencing it. So as you see in the circle there, fear of collision and traffic and fall was more important for women than for men. So we did look if there's somebody on the call or who's interested in looking at the gendered components or age-related components, as we're trying to get different population groups out cycling. We have analyses that report out how these various factors ranked for different groups. So in looking at the different kinds of infrastructure there, this is a complex question maybe, but one that's used really heavily across surveys and survey designs in the US and Portland and the like. So essentially in a series of questions, we ask people, what's your comfort on different kinds of infrastructure? So it starts at the top. So on these like major urban and suburban streets, what's your comfort level on a street that has no facilities at all, on a street with a striped bike lane, on a street with essentially a protected bike lane? The set further down here, my shine shows up, is like, what's your comfort on a quiet residential street, and then what's your comfort on an off-street path or trail at the bottom? Here I've broken it down by gender. I just often get these questions. So you see that real differentiation, that in particular women are feeling very unsafe on major urban or suburban streets with no cycling facilities. So that would be up at the top here. And then the other thing I just want to highlight with the circle and the bullet here that I'm trying to indicate is that, what we really see is that we all need to cycle on major urban streets at some point or another to get to the destinations, to get to our workplaces that we're trying to go to. But with proper treatments like those protected bike lanes, people are feeling like really close to as safe as they do on a path or an off-street trail. So you start to see that those comfort levels really shift to a similar level that people feel when they're off-street. And I think that that's a substantial finding to be reported out on. We ask a few other just perception questions. You know, elected officials and councils often get a lot of pushback in terms of, you know, public perceptions of what people think. There's loud voices in the media speaking out there. So we just ask a simple question, you know, how much do you agree that building more bicycle infrastructure is a good idea for your community? And so whether or not people are cyclists or not, they still respond with high levels of support. I would say that in our survey, we found that, you know, if you look at the Victoria data here, that there are more people sort of disagreeing with this statement in 2019 than there were in 2016. I don't want to delve into whether that's statistically significant at this particular point in time. Maybe wait for our next data point and do a full analysis once we have the 5 years of data, but it may be that there was more controversy in the media at that particular time when this was coming out, or more pushback happening, or maybe within margins of error. So in each of the cities, we also ask a few city-specific questions. We asked, like the city provided the sort of list of facilities that they were interested in, but they wanted just a sense of like who's biking where. And so what this chart that's detailed on, pick your favorite bike route to follow on here, but it was asking in 2019 what percentage of people had cycled on that trail in the past year. So it doesn't mean they use it every day, just means sometimes I go there. And so, you know, I think that of the people cycling, you know, nearly 4 in 5 of them have used one of those regional trails in the past year. And that makes a lot of sense considering how convenient they are in Victoria and how nice they are to ride on. But that's like saying, you know, 4 out of 5 cyclists is using that kind of infrastructure. And then it'll be interesting to see how things change as they evolve across the years. So sometimes you'll hear a storyline that people think that it's only cyclists who think we should be investing in cycling infrastructure. So what this particular graphic and what I've used it for in the past to show is like, you know, as I said, we split people into have you cycled in the past year or not, that very generous definition. And so people who cycle only occasionally. And then we asked them another question that said, would you be likely to cycle more in the future if more cycling infrastructure was built in your city? So yes, people said, cyclists said they would be more likely to cycle. But even amongst people who hadn't cycled in the past year, we asked them, would you be more likely to cycle or start cycling in the future if there was more infrastructure? And they said yes as well. So I just want to emphasize that we try where we can to differentiate in the population and try and understand the different perspectives that might come, whether it's across social demographic or geographical characteristics, or whether it's about cycling behaviors as well. This one should have come before that. So overall, 60% of Victoria cyclists say they'd like to travel more by bicycle than they do now. Sorry, I switched those two around. So that's sort of the high level summary statement, and then this slide that I talked to about how does that break down according to whether people cycle already or not. Okay. So it looks like I'm already on the COVID part, which is great. That was a fast run through the data. As I said, the survey data that we have is richer and deeper than what I've been able to present to you today, just in the interest of not overwhelming you. There is more of it on our IBIMS website. There's a link at the end of this presentation and a link from my lab group's ability. And we do have other reports that are posted there, but also probably more things. So if there's a budding question to be like, do you have an answer to this question? Chances are we might have it and we might look at it. I also run a couple of other studies in Victoria. And so across those various different things, I'd be happy to help anyone on this call with or listen to this call later with questions they might have, and do my best to point it to you. So now we're at a place, and it sounds like these webinars have sprung out of how do we stay connected and keep doing our work as everything around us in the world changes. And, you know, for somebody who studies mobility and social connections, it's been a busy time of me thinking about pivoting research programs and how cities are responding to this. And cities have really been like say there was healthcare workers at the front line, and now it's municipal workers or the next frontline workers, rapidly responding to, how do we support our citizens? How do we make for healthy places? And trying to move just as fast as they can to keep going. So this, you've probably all seen sort of maps about these mobility trends. This one's for Vancouver because it's the routing requests from Apple Mobility. So in light of the fact that we don't have data on travel modes, this sort of shows, if you're not familiar with them, this shows how the requests on Apple for like maps and routing have changed over time. It doesn't pull out bicycles, and it's available for Vancouver and countries all over the world, cities all over the world, and Vancouver, but not Victoria. Otherwise, I would have given you a Victoria slide. So I think, it just tells you the feeling we've all been knowing and having is that there was this like just rapid decline and change in mobility levels. And then they've bounced back in terms of some of the travel modes. And there's a lot of questions that remain out in terms of public transport. So in the city of Vancouver, there are also summary stats now out on sort of how cycling levels have changed at their different counters. I haven't seen sort of a summary stat, and I'd be really happy for anyone to send me one for Victoria. Jamie Fisher, who helps me on this project, a doctoral candidate at SFU, who helps on this IBIMS project, and especially on this next few slides, was also looking sort of at some of the counter data to try and tell a story. But those kinds of things are coming out of cities now as they try and rationalize. But what did we feel? I mean, I think I did cycle in Victoria a month ago now, 3 weeks ago. In Vancouver, I can tell you what it feels like is there was hordes of cyclists out, people who had never cycled before. And, there's many reports of these booming bike sales around the world and supply issues, can't get a bike fast enough, and all sorts of different kinds of people pulling out bicycles, as a physically distanced travel mode, as a method of recreation, as something to occupy yourself in some way to connect with people when we can't connect in the other ways. There have also been here onslaught of electric bikes around as well, and the different kinds of people and routes that are choosing those, as well as these sort of, as I mentioned at the outset, these micro mobility devices, so electric scooters and other things. So there's just a proliferation of there's a growth in volume out on the roads in terms of bikes and micro mobility, and a proliferation of new and different kinds of riders as well. So in light of these changes, which are happening to some degree in cities everywhere, what we've also seen is that these cities needing to make responses to that happening quickly around the world. So municipal leaders working flat out to keep Canadians safe and well served through the pandemic, and then adapting the public streets is a big part of that. So they've had to step in and make changes, as we haven't had motor vehicles on the road, but we're seeing lots of pedestrians, lots of cyclists, all of whom are wanting and needing more space than they did before. So if you're not familiar with it, this guide came out of the Federation for Canadian Municipalities COVID Street Rebalancing Guide. It's an excellent resource that has just been pulled together in past months that summarizes sort of like different strategies for streets reallocation that are being used, with examples from across the globe and across Canadian cities, and really breaks down, different strategies that you might use where and when. So it breaks this kind of period that we're down into these different stages. One of them is these rapid response that I'm highlighting here. So things that happened really quickly that you could deliver in days, that might be really temporary treatments, whether it's cones and the like. So they're like quick and responsive. Then as we move into some kind of recovery phase, how are we thinking about these spaces? So like that physical installation, more interim materials, things that are a little bit more permanent, not permanent yet, but a little bit more structured and strategic, that might take you some weeks or months to deploy. And, I'd argue that we're well into the recovery phase now, but as FCM was developing and launching this, different cities were in different places. So rapid response, moving fast, recovery, what might this look like? And then this other phase that's about resiliency that I think, we're probably talking about and thinking about, but not quite in yet. So how is this causing us to rethink how communities are planned and designed to make sure that they're resilient over the long term? So the treatments might be much more permanent at this point in time. So you can think about where it feels like in Victoria to be along the spectrum right now and what actions you might take along that spectrum. And then we're probably still thinking about whether we're cycling in some phase of this. So it is linear, but it may have some like looping circles depending on the circumstances that none of us can control at this point in time. So in light of sort of these activities that were going on, Jamie and I embarked on sort of trying to understand in the studies for this, so across the Kelowna, Victoria, and Halifax, as well as in other cities separately, you know, what's going on and how are these cities, these mid-sized cities, responding to COVID pandemic and taking action in terms of street reallocation. So we've been tracking through weekly scans of city websites, social media sites, local news articles. We've been tracking the changes that are happening that specifically have to do with maybe removing traffic lanes or pop-up streets. Two sort of general themes across the cities that, and I'll walk you through each of the 3 cities in a minute. Two general themes in terms of what cities are saying the rationale is for doing this kind of work or their efforts, what they're trying to accomplish, is to support mobility as cities reopen and to bolster COVID-19 recovery for businesses. So I think that lands with the story in Victoria. In the 2 IBIMS cities, Halifax has reallocated the most space and Kelowna the least. So I'm gonna, in the next 3 slides, show you maps of each of those and the findings, and then I'll just have some high-level summative statements and I'll be done. So in Halifax, let me get my notes on these ones because this stuff is hot off the press. So Halifax has, what I show here on the map here is the existing infrastructure, and this is a zoomed in area of our Halifax for anyone who happens to be familiar with it. The black is the existing infrastructure that was there, and then you can see different pictures and examples of what they've done in terms of sidewalk expansions in yellow, slow streets in green, and then something that would be like a people priority zone in red. So you can see where those happen to be. So even in Halifax, the story here is that they're really moving forward on their integrated mobility plan. So 50% of the slow streets that they've implemented, or the green lines that you've seen here, are actually along streets that were already designated in the integrated mobility plan that they were just getting started on. Okay, so they've taken an existing plan and they've actioned to immediately take move forward much faster than they would have otherwise, and in a temporary way, to build out slow streets along those corridors. And then the city's also taken a very responsive approach by having a website and crowdsourced input to where they think they need changes happening. They have spent $65,000 on extra pylons and barriers to support this response, but otherwise they've tapped into existing materials that they might have had there. So the story in Kelowna, which is hitting the news for all sorts of other reasons in the past week. So there hasn't been a lot of street reallocation in Kelowna. So here you see the black again is the existing infrastructure, which they have a very good coverage of painted bike lanes and a few other things in Kelowna. And they have closed down one strip here in the downtown area as a people priority zone. So according to the news and the media, the people priority zone was intended to allow businesses to enhance capacity using public space on the road. So there hasn't been a lot of talk specifically about cycling or active transportation at this point in the news and media and websites, but rather this one seems to have a focus on businesses reopening, which is important and valid in the survival of our cities. So Victoria, which probably is a particular interest to this group here, fell somewhat in the middle in terms of the actual distances that people that have been installed. So again, the black routes are the existing bicycle infrastructure. You see some sidewalk expansions, some repurposed infrastructure for walking and cycling, you know, along Dallas Road and through Beacon Hill Park. And the people priority zone. So I would say that this isn't yet, like the priority here seems to be really certain specific spot areas. It's different than Halifax in that it's not going along the plans that were already in place necessarily for the most part, but seems to be sort of responding to some urgent needs within particular areas, supporting active transportation or supporting travel through parks in a way that's quite like, of course, what's happening in my home city of Vancouver around Stanley Park and Beach Ave and the like. Just as closing comments about this, because I am thinking a lot about how cities respond to this, these 3 cities and cities across Metro Vancouver and Seattle. There's a few considerations I just want to bring up here. Part of them are things that are in the narratives if we've done the work, or in conversations that I've had with city staff, or as reading through the FCM guide. You know, this conversation about temporary versus permanent, are we in this kind of recovery stage or moving into resilience stage? When do we start to make those investments to make things more permanent? Or what are we learning from these pilots as to whether we would make them permanent or not? Are we gathering data on that? And whether these sort of immediate reactions and responses that might have taken years and decades in some cities, you know, are they going to have lasting impacts on mobility and how people get around? The point about synergy with existing mobility plans, there is some pushback that these kinds of slow streets have been enacted quickly. They were done without consultation, not in these cities per se, but in general, there's a narrative that they were done without a consultation. And so you'll also see, as I pointed out in Halifax, that they decided to implement those slow streets specifically along corridors where they'd already done their consultation. They already intended to make changes. They might have just gone lighter, quicker, and cheaper than the full blow up, the full build out. So just it's interesting to watch how cities choose to play their cards on where they're putting infrastructure. Is it, or these slow streets, is it as an opportunity to get workers to their jobs immediately, as a response to heavy pedestrianized areas? Is it a response to business, or is it responding to where we actually needed to make network connections? What kind of evaluation is happening? So as city staff are working hard to actually set these things up, do they have time to do counts, to understand what safety considerations are, what the usage is? You know, are they putting them in the communities who need them most? And I just acknowledge that everyone's working flat out right now from home with children and other challenges in their life. So we're doing the best we can, but what do we know? And then the big unknown, of course, is the future mobility trends and where this is headed. So, you know, we don't know if people are going to get back on transit, if we're going to be able to handle crowded transit anymore, what other different choices are people going to make. You know, if they're wary about transit, will they go into their private vehicles? Will they get on bicycles? You know, what are we going to see in terms of trends of micromobility in some of these cities? E-scooters are popping up, both personal and conversations about shared ones. Do we have spaces for them? Are these slow streets going to enable positive interactions with them? These are things that we can't know yet, but cities are in the position of having to like predict the future and do their best to plan for. And I want to acknowledge the work that takes. So that's all I have for slides. There's various people involved in the IBIMS project as a whole in terms of funders, people we communicate with. I also want to highlight my investigator team, Karen Laborie, who's been the Victoria coordinator through the course of this project, Jamie Fisher, who helps a lot with the data analysis and also with the COVID kind of work, and Susan Therian, who's off on mat leave, but sits in Kelowna and does a fantastic job of keeping it ears to the ground. So I want to say I'm coming from Vancouver. I travel to Victoria often, but I really rely on my relationships with people and staff within these cities to ensure that, you know, my conclusions from looking at a map or a data point are interpreted appropriately. Thanks so much. Oops, I'll go back to the beginning.
Thank you so much, Megan. I think, yeah, it's so obvious like how much work it's put into this kind of research, and it's really impressive to see kind of the response like of your lab to like gather research that's just like that came out of nowhere, or like to find out to look into the kind of COVID response infrastructure. I guess that's the word I want to use. Yeah, thank you so much for your presentation. We do have a few questions. I actually have a question myself. Do you think that with COVID and like with this new like research that you're gathering, do you expect that like a future survey that you'll put out for the IBIMS research, do you expect that'll change after kind of this like surge in new cyclists and yeah, micromobility and like scooters and things? Do you think like people are going to have like a whole new answer when you ask them again?
So we've been trying to, I haven't been able to pull this off quite yet, the plan forward, but our intended strategy was to do another survey in 2021. Who knows what 2021 looks like, but we're just trying to sort of figure out, is there something that would be a strategic move for us to do some data collection in 2020 before our planned time in 2021 to sort of capture this moment as it is. I'm sure all of us are a bit overwhelmed with surveys and responses right now. But also, I'm really just cognizant that the cities I work with may not have the resources and capacity to gather this kind of information right now in the same way that Toronto might do. And they won't show up in national surveys to that sort of same degree. So yeah, we're certainly thinking about what would be the value of trying to do something else. Our surveys have always been done in September into October. Sometimes that's a question here. And so there's still a window there. I like things to be matched. And it's been difficult to figure out when the right time is to pivot all my research programs because people are very sensitive to certain issues depending on what's happening. We've sort of been in, although we're in BC, of course, we're sort of wavering right now on our relaxation of, or on our restart program, let's see, this phase 3. So I don't know what it's going to look like in September and October, and it's hard to figure out if I should take the resources of our project and put them all to 2020. But anyways, the short answer is, Justine, yeah, we're really thinking about it, and I'm hoping we'll be able to pull it off.
Awesome. Let's see, we have a couple more questions from folks. Eric wants to know, can you comment on the new amendments to the BC Motor Vehicle Act to allow power, wheelchair, and mobility scooter riders to use designated cycling lanes via the micromobility pilot projects initially? Do you think this is an important step forward, particularly given the need for seniors and PWD to physically distance?
Yeah, so this is, these pilot projects, I don't know if everyone on the line would be familiar, but the Motor Vehicle Act, the ministry opened up an opportunity for communities to put forward pilot projects that they wanted to run, some of which have included communities saying it was important to look at creating legislative environments that meant that micromobility devices, be it e-scooters, kick scooters, and the like, could be used on city streets, on bike lanes, and on bike paths. I think that it's certainly time for an update to consideration to bylaws, being all of these new devices are showing up on a fast pace, and people need to know where they can ride them and need to be allowed to ride them in some places, versus right now in many cities, it's simply not legal to ride them anywhere, but they're here, they're being ridden. So, there's certainly, I will leave it to the cities to figure out how best to, they want to enact that. I also have certainly heard that it's something that's difficult to enforce, but I think that we need to consider all of the mobility devices that are coming because just that rapid uptick in how they're showing up right now, and we need some awareness as to where we're supposed to be riding. I have a separate project that would show up on the CHATR website, which started last year before any of this was present, that was looking at the readiness for Metro Vancouver in terms of shared micromobility. So in Metro Vancouver, we don't have or in Victoria, you also don't have a sort of shared e-scooter program like exists in cities all over the US. And part of that is because of these legal concerns and issues. I would say Kelowna, which is one of my study cities, has some places where they're allowed to have these shared e-scooter programs and have implemented them in the summertime. So it's not to say there's no efforts to do this, but it's not a widespread program. So I think it's time for cities to respond and react to how best they're going to move forward. And I just want to emphasize here, there's sort of a difference between, they need to move forward now because there's a lot of personal micromobility devices around, and we need to know where those people are allowed to be. And the shared ones might be a different case. I think there's also challenges certainly around enforcement, and even the fact that there are personal devices and shared devices can make it extra challenging in terms of police enforcement.
A follow-up question to that is, do you think this will be important for public perception of bike and bike plus infrastructure, talking about the
So the emotion on this went to council recently around moving forward on changes to the legislative environment to allow micromobility and shared micromobility. And, you know, when I wrote to City Council and shared with them the results from our research, my lesson was that there does need to be a lot of education and training around and communication about where micromobility is allowed to be. But for it to actually be effective, we need to make sure that there's enough space for these places to travel on. So if we don't want to see e-scooters on the sidewalks, we need to make sure that there's space for them on the roads and clear that they're supposed to be there and legal for them to be there, be it on the bike paths or the roads. And then we need to make sure that there's enough space that they can safely travel there as well. So I've sort of encouraged my conversations with Hub here in Vancouver, I've sort of encouraged them to, that there's an opportunity here, that micromobility is coming here and it needs space for the road space as well. And so to sort of look at that and say, we need space for both the bike and the micromobility devices that are coming here. And so we're going to need more space on the roads for the greater volumes. So I don't want to see people, I don't think it's beneficial to be pitting people against each other. I never think that. Everybody needs enough space and designation on the road to feel like they can safely travel there. So the sidewalks need to be left to people walking and going at that pace, and we need to have infrastructure that makes it safe for people to travel on micromobility devices, on bikes. And I just want to highlight that often micromobility often applies to e-bikes too. So there's just like really tricky areas of the law, and I don't even know all the technical names of these various devices. Every place uses a different set of names. So it's certainly a challenging area in terms of enforcement.
Great, thank you. We have another question. This one's from Julian, and he asked, did you ask how many cyclists are car-free or want to become car-free in the survey?
We asked people, we know about the households and what the ownership levels are in terms of cars, bikes, in terms of e-bikes too. I don't want you to ask me that one off the top of my head right now. So I guess we know that. We didn't ask a question that you would often see on like car share kinds of surveys and things like that about like, you know, have you sold a car because of you joining this kind of company? So we did not ask that kind of question. It's a great idea for future.
Let's see. We also have one from Kim. Are you planning or able to present your findings to Greater Victoria politicians and staff? For example, Esquimalt has an active transportation plan to be developed this fall, so the timing is good.
I hope so. So we have over the years certainly done that, and there's a list of different presentations that's on our website as well. And when the 2016 results came out, I certainly presented in person. The City of Victoria staff helped organize a meeting and brought in staff from Esquimalt, Saanich, and Oak Bay, and possibly beyond. And from that meeting, for instance, the kind of feedback I look for is they really wanted to know the breakdown, you know, what did their own community constituents say? And so we actually went through and made reports that had breakdowns for each of those communities, albeit sample sizes get small when you look at just Oak Bay or something like that. But we have looked at that before. I welcome any and all opportunities to speak and present to council, and often communicate with staff in the City of Victoria. And I know Karen Labrie often also is speaking to Saanich through different projects and contacts there, as well as we are always in contact with the CRD. Anyone on this call is welcome also to, so there's at the end of the slide deck, there's how you would cite our results and where our website is. And so you would be welcome to use any of the stats. And I've often seen people from different groups sort of use the data, and I hope you use the data. That's kind of why I'm doing this presentation today, is to say if there's something you need to know. So if it's in these, just use it and cite it. And it's even better if you let me know, because that helps my funders think that our work is very helpful and useful. I would say I've also written sort of op-eds and the like to try and sort of provide, you know, there's loud voices in the media, and to try and provide, like, this is data from 860 Victoria area residents, right? So it's not my voice, it's the voice of the population at large.
Yeah, it's something I was really impressed with when we were setting up this webinar was you were asking me like, do you want to hear about gender mostly, or do you want to hear about like a specific area? It's just, it seems like there's all sorts of like facets of the research, which is really, really neat. And so yeah, when you can get it actually like down to the neighborhood or like down to a municipality, I think that's just, it's so helpful and like so usable, and it's great that it's open source.
Right. So in our, like, for instance, in our COVID work too, like there's other, I spoke on the population survey here, but there's other aspects of work we're doing them. One of them is like, where is the infrastructure? Which neighborhoods is it in? You know, are we rolling this out in terms of equitable considerations from that point of view? Another sort of set of questions from the COVID is along that lines of like, which neighborhoods are getting these kinds of lighter, quicker, cheaper interventions that are happening? You know, and again, people are responding, rapid response. They're just doing the best they can right now, perhaps, but there's still some reflection to do as we think about how to move into resilient communities and what's working and what's not.
For sure. Michael wants to know, how is the health economic benefit calculated in the baseline finding report?
This one. So we're using a tool put out by the WHO, the World Health Organization. It's called the Health Economic Assessment Tool. It assesses the economic impacts of, due to the physical activity benefits of cycling and related safety outcomes. It doesn't look at economic benefits. Sometimes people ask me about business impacts and impacts on tourism. That would take very different kinds of methods about intercept surveys and business surveys, et cetera. So this is essentially looking at how many more people are cycling or how many more minutes a day of cycling are happening and what that translates into in terms of mortality reductions over a longer period of time. So it's sort of one piece of the big economic assessments that people might do, but health is very often overlooked when people are doing considerations about is this a worthwhile investment or not. There are a couple of presentations I could point you to on our website from this, and there's a publication that's just in its final academic peer-reviewed publication, in its final stages of review, that I think will be out in the next month or two, and then we probably do another piece of work on that. You know, I can tell you the benefits outweigh the costs, because the way health-related economic benefits, because it all has to do with life saved and lives lost, and the human life is worth a lot of money. So in the cities that we have, you know, based on projections of that, what the publication did is based on projections of the shifts in modal share, you know, is this a worthwhile investment from the health-related perspective? And I can tell you the answer is yes.
Great. Another question from Kim. Do you think lowering cycling infrastructure used by lower income, do you think lower cycling infrastructure used by lower income households is A, reflective of actual cycling use, B, reflective of location/routes of cycling infrastructure, and or C, response demographics to surveys? It seems lower income households are good candidates for cycling infrastructure, so the results are surprising and perhaps an opportunity or focus area for infrastructure development and cycling uptake by lower income families.
Let's see if I understood the question correctly. So I think, I mean, well, let's see if I answer something that responds to your question, if I understood it. So a difference that you saw early on in the results that I was showing was that when you ask people if you primarily use, what mode do you primarily use for cycling for transportation, lower income households show up. If you ask people, have you cycled in the past year, you know, you start to see those higher income households showing up, meaning that higher income households have more choices in terms of the transportation modes they might use. And in this and in other projects that I've done on bike share and the like, you know, in some lower income households, once you've made an investment in a particular transportation mode, that's what you use as your primary mode to get around. You know, I would say from the part, I didn't present it here, but I work on where the infrastructure is in Victoria. Does it serve lower income communities? On average, across the study area, there is more infrastructure in low income communities, or there's not an equity issue in terms of the distribution, in terms of neighborhood level incomes. Now, I'm sure everybody on this call can tell me that there are areas within Victoria, the greater Victoria area, that are low income that don't have good infrastructure going to them. So I said, on average, we don't see a trend that there's more infrastructure in high income neighborhoods, which is a common trend that you see in the US. So on average, we don't see that in Victoria. But there are sort of pockets of low income neighborhoods that aren't well served. And there is slides that would show up on our website. So this is Jamie Fisher's publication and presentations on it around spatial access to cycling infrastructure. It'll show up in the 2016 slides. I'm happy to show them. And it'll show you that there's pockets where we still need changes to happen. So there are neighborhoods within Victoria that are low income, that are not well served, and those should be areas for intervention if equity is a priority for you. Okay? But on average across the city, it's partly because there are lower income, according to census data, there's lower income areas in the downtown area, and there's a lot of infrastructure through that downtown area. So there are neighborhoods that have lots of infrastructure, and then there's some low income neighborhoods that have less infrastructure. So on average, we don't see a trend, but we did a mapping analysis, a spatial analysis, and what it will highlight for you and what we've shared with city staff are specific neighborhoods that are low income neighborhoods that don't have infrastructure right now. And we put those forward as being high priority areas if equity was the goal.
Great, amazing. Laurel says, can you speak to how to address concerns from the Black community around bike lanes not being enough to make Black people feel safe in their neighborhoods?
Yeah. I would love to be able to speak to that. So with Victoria data is what I would love to. And I think I'd be asking groups like this if there are organizations or groups in Victoria that you think you could facilitate connections to that would allow us to explore that. So in another related study in Victoria, it's called Interact. Maybe some of you are participants in it. If you are, thank you very much. We also are doing qualitative interviews to understand sort of a lot more depth of how people feel and perceive cycling and how it relates to their well-being, their social participation, their connections to their community. We did those interviews 2 years ago. I think it's highly relevant right now that we would go back and do a series of interviews, and perhaps there would be a different set of questions within that and different population groups. And I would be interested in connecting with community groups in Victoria that were interested in having their voices heard. I think the city as well would be interested in hearing that kind of data. So if anyone on this group or associated NGOs, you want to work forward to us. Jamie Fisher has also been on the island and talking to various Indigenous groups at this point in time to also understand sort of what their needs are in terms of cycling. Those kinds of projects require some different navigation, but there's certainly some aspects that I think we should be starting on right away.
I agree. I'm just cognizant of time. It's 11:59 for folks who need to leave before noon. I'm just going to do a quick plug for some of the Bike to Work Society's upcoming events and also the continuing projects. So I'm not sure if folks can see my PowerPoint page here.
No.
No.
It's very cute.
Okay. How about now?
Yeah.
Okay, wonderful. So yeah, coming up, we have another webinar next Wednesday with Evan Thomas from Dockside Physiotherapy, and he's talking about the truth about common cycling pains and injuries and what to do in his webinar called Pedaling Pain. And folks can register for that webinar right now. We're also finishing up our scavenger hunts and discovery rides and ride the distance rides that have been developed for COVID as well. I think today we are releasing the Gorge in Fairfield for the discovery rides, scavenger hunts in Esquimalt/New Royal and James Bay, and then ride the distance is called Point to Point to Point, and folks can check that out at the gbcc.bc.ca website /theme rides. We also have my email and Megan's email here, all of our social media channels, and as well, I encourage everyone to check out our cycling resource library, which is at our website, bike2workvictoria.ca. And thank you everyone for attending this webinar. Thank you, Megan, so much for the time that you put in and for the great information and the great answers to the questions. And there are a few more questions. I'm so sorry for those folks we didn't get to, but I'll be sure to send those to Megan, and I hope that we can answer all the questions in the end. I think we will finish there. Anything else, Megan, from you?
Feel free to write me if I didn't get to your answer or question, or if you wanted to know which resources I might have mentioned. Thank you. Thanks so much.
All right, thanks everybody. Have a great day, continue cycling, and we'll see you next time. Bye-bye.